This is Brendan with CPR-Life Services with another unboxing video from ViTACSolutions. I got some gear right here. I don't know what it is yet. Can't wait to open it though. I'm telling you what. So we have an IFAC here from ViTACSolutions. It looks like it's one of their original product lines, has their logo on it. IFAC stands for Individual First Aid Kit. I can't wait to see what's in here, but let's take a look at the outside. Man, it looks like it's made out of a really durable material. I really like the zipper, dual zipper. Has the Velcro on the top. Also has interlocking systems, so you could add this onto another backpack, or you could add on to this module itself as well. That's pretty cool. Expand that. Let's go ahead and open this up. I like that it has that Velcro up there, because then you can just do one of those motions real quick. Got your trusty combat application tourniquet. That's from North American Rescue. Tried and true. I like it. I like it a lot. Man, it's got that Velcro on there, good 2 inches. It's got that plastic landing spot, so you can go ahead and put that onto the artery, so that when you crank down on this windlass right here, it puts all the torque right there, locking into the mechanism. Go ahead and put that Velcro strap on there as well. Put that time. Always put that time. All right. Remember, you could bleed out in less than 90 seconds from RTO bleed, and that's when you can use this tourniquet right here. That's amazing. From North American Rescue, this is the emergency trauma dressing. So this is basically a pressure dressing, all right? Anytime you have a fast venous bleed, it's also life-threatening, so you really want to identify it and treat it as quickly as possible. By using this pressure dressing, it puts a lot of torque in that area. But the good thing about it, it's a little bit elastic too. Once we open this up, it's all gonna make sense to you. The reason why is because with any kind of trauma, there's gonna be inflammation involved. And we don't want this pressure dressing to accidentally become a tourniquet. So always reassessing that distal post. You want that distal post when you're doing a pressure dressing. You do not want that distal post when you're doing a tourniquet. All right, keep that in mind. Oh, personal protective gear. Always put on your PPE and BSI. They give you 2 gloves right here. That's awesome. Awesome. All right. So furthermore into the bag, it's got some elastic. You could go ahead and put more equipment in here. I like it. Awesome. It has 3 pockets right here. It's in pocket number 1. All right, got your awesome in the fact that it's elastic. And if you combine this with, okay, they got some gauze sponges right here too, 4x4s. So you can go ahead and utilize this for those minor injuries. Controlling that bleed, very important. What else do we have in here? All right. This looks like a triangular bandage. Triangular bandages are so versatile in the fact that you can use them to secure, oh, got some safety pins in there too. You could use it to secure things to the body like a splint. You could also use it to sling and swath if you have a fracture on that forearm. Making sure to immobilize that area. Ooh, this is a pretty big one too. Look at that. Oh yeah. And we're gonna go in depth in how to actually use this. There's so many different ways that you can use this triangular bandage, also known as cravat. All right. Check that out. That's awesome. Cool. So it looks like we have some compressed gauze here. Looks like it is 4.5 inches by 4 yards. That's a lot in this little package, right? Compressed gauze is really good at controlling that bleed. So this is great. Also very good to have it in the same pocket because it's easy to use, easy to identify. You know exactly where it is. You can take it out as you need it. What else do we have in here? Oh, there you go. Combat gauze. Now, you can see how it looks very similar. Different packaging and things of that nature as well, but people think gauze is gauze. Not necessarily. So this is compressed gauze. It's just compressed into this small, tiny space. This is combat gauze. People say quick clot interchangeably with combat gauze. Quick clot, gotta understand, is the brand. Combat gauze is this actual piece of equipment. It's a hemostatic agent. A hemostatic agent promotes that clotting. Remember your triad of death, your triad of shock. It's coagulopathy, hypothermia, and acidosis. So this is going to be checking that box for coagulopathy, all right? The body is unable to coagulate, form blood clots, so we're going to help it along just a little bit with some hemostatic agent. Chest seals. All right, looks like it's a pack of 2. Understand that typically when there's penetrating trauma, especially from a projectile, there's going to be an entrance wound and an exit wound. That exit wound is substantially larger than the entrance wound just from that projectile alone. So being able to identify the entrance and exit quickly and patch it up with a chest seal, that's extremely important. Now it's really important that you understand that your thoracic cavity starts from your jugular notch all the way down to your navel, your belly button. That's a big area. Wondering why? It's because you have an organ that helps you breathe called your diaphragm. When it contracts, it causes negative pressure in that thoracic cavity, pulling air into your mouth and filling up your lungs. When it relaxes, reverse happens. Air comes out, you exhale. Great. But if you have any kind of penetrating trauma through your thoracic cavity, air could be sucked into your thoracic cavity through that entrance or exit wound, and it gets stuck there, all right? By patching this up, it prevents more and more pressure building up, potentially collapsing your lung. That's called a tension pneumothorax. This is step 1 of how to treat a tension pneumothorax, utilizing this chest seal. So this is great that they gave you 2. That's amazing. It's this right here. All right. So this is your TCCC card. This is your casualty documentation card. All right. It comes with an amazing diagram. It's simplified because not everyone knows how to document. Being a lay responder, being a bystander, things of that nature. You want to make sure that documentation is somewhat standardized across the board, because how much time did it take for you to get to your patient? How much time did it take for you to treat your patient? How much time did we have to wait for an evacuation vehicle to get the patient? Along the lines of that patient care, there's going to be a lot of hands on that patient. So having proper documentation, accurate documentation with that patient is going to make it so much easier for the continuum of care. All right. So with this diagram, you can go ahead and actually draw what's wrong with the patient. So if they're missing an arm, oh, go ahead and squiggle that out. If they have a tourniquet, go ahead and draw that tourniquet, or a T for that tourniquet. It also breaks down the rule of 9s for burn casualties as well. And we'll go in depth into later videos about the rules of 9 and how to treat burn casualties. So it also has the patient identifiers, mechanism of injury, injury sustained, and signs and symptoms. It's front to back as well with the treatments rendered. So if you actually think about that, patient identifier, mechanism of injury, injury sustained, signs and symptoms and treatment rendered, that's going to be your MISH report. All right? That's going to be a quick 30-second report that you could use to hand off this patient to the next person, the next medical professional, so that we could save time and have an accurate accounting of that patient, hopefully, right? I'm not saying that everything's going to be perfect the first time you treat a patient. Things can go wrong, so you have to be able to adapt and overcome, and that's why documentation is always evolving with that patient, because going back to a tension pneumothorax, that takes about 15 to 20 minutes for it to actually build up pressure in your thoracic cavity for you to show signs and symptoms. So you're not going to necessarily find that from your initial treatment, from your initial patient assessment. It may take a little bit of time. It may take the next person to find it. So being able to identify it and document it, going on and on and on to the next person, is going to give that overall picture for when that patient gets to the emergency department. That's awesome. Looks like they give you 2 compress gauze. Got some trauma shears here. This is great. These are specialized scissors to help expose that patient so you can visually see and physically inspect an area for any kind of further injuries that that patient may have sustained. So this is awesome. Emergency mylar blankets. Now understand, going back to the triad of death, coagulopathy, we're helping to treat that with that hemostatic agent. Another facet of the triad of death is hypothermia. Now that's, you're getting cold. Your body's losing the ability to retain and regulate its own temperature. So you want to try to keep that patient as warm as possible, getting that patient off the ground, get them onto a stretcher or a litter, putting this blanket on them so that it helps them retain that body heat, keeping them warmer longer so that you can effectively get that patient to the next level of care. So it's awesome. What do we have here? All right. So eye shields, very important. I like my eyes. I like to keep my eyes. I'm assuming that other folks would like the same. All right. So with these eye shields, if you have any kind of trauma to your eye, typically your eyes move symmetrically. They move in conjunction with each other. So if one eye is going one way, the other eye should do the same thing. So it's really important to have eye shields, because if you have any kind of trauma to your eye, you want to be able to cover it and protect it as much as possible. That's awesome. What else do we have in here? Got you a good pen right there. Permanent marker so you can write on that tourniquet. Nasopharyngeal airway. This is awesome, also known as an NPA. This could be performed on an unconscious patient as well as a conscious patient. So this is very versatile. There is a proper technique of how to use this on a patient. So we'll go into that in depth in later videos. So stay tuned for that. That's awesome. All right, looks like that's it. This is so much stuff. I can't believe that they put it all in one bag. For me, putting it back into the bag, that's going to be a little difficult. I'm always good at taking things out of stuff. Getting stuff back in, that's where I have some trouble right there.